my name is Jennifer. I'm a registered nurse and I'm going to be talking today about asthma education for the high school student. If you have asthma, you can learn how to manage its symptoms so that it does not affect your everyday life. You can talk to your doctor or your school nurse about creating an asthma action plan. You need to know your triggers and you need to know how to avoid them. Take your medications as prescribed and avoid triggers even if you are not experiencing symptoms, because these will help keep your symptoms from returning or worsening. It may help to set a reminder on your phone to alert you when it is time to take your medication. Keep your rescue inhaler with you at all times. Talk to your school nurse and find out if you're allowed to carry it with you while in class, or if not, discuss an action plan on how to get to this medication quickly when your symptoms arise. Also, learn early warning signs of an asthma attack so you can get help if you need it. What is asthma? Asthma is a disease of the lungs that makes breathing difficult. There is no cure for asthma, and people with asthma must take action to manage, control, and prevent these symptoms on a daily basis. Symptoms come and go, and the severity of airway inflammation can also change over time. With asthma, the airways in the lungs become swollen and inflamed and are sensitive to triggers in the environment, such as dust, cold weather, smoke inhalation, or pet dander. These triggers, when breathed in, can cause muscles that wrap around the small airways in the lungs to constrict, making the tubes that allow air to pass smaller, which makes breathing difficult. Symptoms may be different in frequency and severity for people with asthma. The most common symptoms are shortness of breath, feeling of tightness in the chest, wheezing, which may sound like a whistling while breathing, cough for more than 1 week, which may worsen at night or after exercise, or a cold for more than 10 days that goes into your chest. Next, let's talk about the causes of asthma. Research is ongoing on what exactly causes asthma. However, there are a few common factors that play a role in the development of asthma. Asthma can develop in babies, children, teenagers, and adults. Symptoms can come and go throughout the lifespan. However, early and how often children are exposed to certain illnesses and animals can also influence the development of this disease. Some infections decrease the risk of developing asthma, while other illnesses are known to increase the risk of development of asthma. The most common causes of asthma include genetics. If your parents or siblings have the disease, you might develop the disease as well. Dust particles in your house, cockroaches, certain types of molds, smoking and secondhand cigarette smoke, respiratory viruses, cold air, and pollution or particles and chemicals in the air. Prevention. It is important to learn your triggers and then learn how to avoid those triggers. First, you need to recognize early signs and symptoms of asthma. Always carry a copy of your action plan with you. Give one to your school nurse, another to your coach or PE instructor, and if you have a job, make sure to give a copy of your plan to your employer. Take your controller medication every day, even if you're not experiencing symptoms and you're feeling fine. This means your medications are working. Your doctor will work with you to develop an asthma action plan that outlines what to do and what medications to take when you're experiencing asthma symptoms. Generally, 2 types of medications are used to treat this disease, which include rescue medications and controller medications. First, let's talk about rescue medications. These medications are fast-acting meds that open up airways and relieve wheezing, tightness, and breathlessness. This is a medication that is taken when you're experiencing an asthma attack or have a decrease in peak flow, which we will discuss later. The rescue medication first prescribed is usually a quick-acting bronchodilator albuterol inhaler, which allows medication to go directly into the lungs, which will provide fast relief and only stay in the body for a short period of time. Rescue medications do not prevent symptoms from reoccurring. If you are needing to use this medication frequently, ask your doctor about prescribing a controller. Always carry this medication with you at school, when you're playing sports, or even if you're on vacation. Know what dosage you need to take, how many puffs you need, and how often you can take this medication when you're experiencing symptoms. Also, it is important to know what to do if the rescue medication is not relieving your symptoms. The next type of medication used to treat asthma is controllers. They work over a long period of time to reduce airway swelling and mucus production. They help to reduce the frequency and severity of symptoms over time. A controller is needed if symptoms occur more than twice a week and cause you to wake up during the night more than twice a month. These medications should be used on a daily basis regardless of the presence or absence of symptoms. Inhaled corticosteroids are frequently used and recommended as the first treatment for asthma maintenance. Corticosteroids decrease inflammation in the lungs and are available via pills, liquid, injection, or inhalation. There are many combinations of rescue meds and controllers that may be tried until you have achieved the most relief from asthma symptoms and experience the least amount of side effects from the medications. Next, in managing your asthma, it is important that you follow your asthma action plan. An asthma action plan is an individualized plan that outlines the treatment information, what kind of medications to take, and when to take them, depending on the severity of your symptoms. Your plan will also have instructions on when to call the doctor or go to the ER when rescue medications are not working to alleviate your symptoms. Your doctor may also measure your peak flow when you are healthy and not experiencing symptoms. This reading will be used to determine when, how much, and how often you will need to take rescue medications. When your peak flow reading decreases, it is a sign of airway inflammation. Utilizing the peak flow in monitoring your asthma can help to detect airway changes even if there are no signs and symptoms present. Peak flow can help detect a flare-up up to a day or two before symptoms arise and asthma attack occurs. Your asthma action plan will have guidelines on how to use your medications based on your peak flow reading, as well as the signs and symptoms that you're experiencing. So how can you monitor if your treatment is effective? The goals for asthma treatment is so that symptoms do not occur more than once or twice a week, and you are not experiencing symptoms during the night which cause you to wake up more than twice a month. Also, you should be able to participate in all sports and physical activities. So, you will know if your treatment plan is effective if your asthma is well controlled when you experience few if any symptoms, few if any awakenings during the night caused by asthma symptoms, no sick days from work or school, no limits of participation in physical activities, no ER visits, no hospital stays, and no side effects of medication. Treatment of asthma goes beyond taking your medication and managing your symptoms. You will also have to learn your triggers, learn how to avoid them in order to help prevent aggravating your airways and causing an attack. Ways to help you begin lifestyle changes include the following. Use your air conditioner. This reduces airborne pollen from trees, grasses, and weeds, lowers dust mites, and also try to keep your windows closed and stay inside during pollen season. Next, minimize dust in your home, which can help reduce nighttime symptoms. For example, cover your pillows and mattresses with dust-proof covers, remove any carpet in your bedroom, and use washable curtains and blinds. Also, you can clean damp areas like your bathroom to help prevent mold from forming. If pet dander is your trigger, try to keep your pet outside as much as possible. Do not hug them or let them in your bedroom. Next, make sure to have your house cleaned once a week. Wear a mask if dust triggers your symptoms, or you can also have someone else do the cleaning. In the winter months, wear a scarf over your nose because cold weather can affect your airways and can aggravate your symptoms. You need to exercise regularly and avoid smoking and secondhand smoke.